Hello and welcome to the pharmaphorum podcast. I'm your host, Jonah Comstock, editor-in-chief at pharmaphorum. I'm joined today by Dr. Benny Alouf, chief medical officer at Limbix. Welcome to the show, Dr. Benny.
Thank you, Jonah. I appreciate being invited.
So I understand that Limbix makes a digital therapeutic called SparkRx for the treatment of depression in teens, and that is currently available in clinic in several children's hospitals under the FDA's enforcement policy. Tell us a little bit about how that works and how you're out there in the market right now.
So we in October of 2021, we launched SparkRx for adolescent depression, a digital therapeutic for adolescent depression under that enforcement policy. So we're not cleared by the FDA. We are working currently on launching an internal pivotal trial, the data of which will be submitted to the FDA for potential clearance as a software as a medical device.
So hopefully by the time the enforcement discretion period wears off, you'll be sort of ready to
go. Correct. So right now there is a draft transition plan that was published by the FDA. We have commented on it, and it hasn't been finalized yet. As long as there is a public health emergency, which we're going to hear about more this Friday the 15th in terms of an extension, pretty much that enforcement policy continues. And also, we have several children's hospitals that we're working with through different pilot studies doing treatment with SparkRx for patients either in the general population or in some of the subspecialty clinics such as cardiology, weight management, oncology. We also have, under the enforcement policy, distributed to many providers throughout the country. Nationally, we have over 100 providers using SparkRx for the teens that they see in their office. We have over 300 kids that have already signed up to be treated with this digital therapeutic for their behavioral health.
So tell me more about the digital therapeutic. What does it look like? What are the principles that it's built on, and what's the experience like for the patient?
Sure, I would love to. So, just by way of background, the first important thing to recognize is that digital therapeutics are very specific. They are specifically FDA evaluated, regulated. They're shown to be safe and effective, and they can make claims that they either prevent, treat, or mitigate a specific condition, and that sets them apart. And right now, there may be a dozen or so on the market. And that sets them apart from, and I just read this morning in an article, approximately 350,000 other wellness and health apps that are out there on the App Store, and apparently 250 new ones being added every day. And what sets them apart is, as I mentioned earlier, they are truly tested. They have to pass randomized controlled trials, and they have to be reviewed, and they are under strict regulation of the FDA. And what they do is they have specific active ingredients in them, much like a medication would, and they're treated as devices. So they're otherwise known as software as a medical device. What SparkRx does is it's a 5-level, 7-week program that takes what a patient would undergo in terms of the treatment plan with a therapist and translates it into a digital program that a patient can use in their hand at their convenience. So right now there is a major access issue to getting face-to-face definitive psychotherapy, and this allows patients to immediately get started on a cognitive behavioral therapy program to assist them through the treatment of their depression.
Now, I know one of the kind of big, I, not necessarily criticisms, but questions that comes up when you start to talk about this is, is this meant to be a substitute for therapy? How does this interact with person-to-person therapy? I think it's important to kind of understand that distinction. So right now, like, what can an app do? When does a person need to step in?
Yeah, so I'm a practice. Well, I'm not a practicing pediatrician. But I'm a board certified pediatrician. I haven't practiced in a few years, but I did spend 15 years in clinical practice. And during that time, I saw the transition of healthcare moving a bit away from the direct provider care, especially in primary care. There was a lot of introduction of uh, digital components to the care that physicians were providing in their office. There was the introduction of electronic medical records. Um, Urgent care centers were starting to pop up, and a lot of them were appealing to pediatrics. And there was pediatricians and primary care providers really felt a bit under threat that they're being replaced. The goal and the design of the digital therapeutic is not to replace the provider, but to be an adjunct to therapy that they are providing. It's meant to complement what they're already doing. And that could be anything. So, for instance, if a pediatrician sees a child in their office and screens them for depression, which is something that's part of the guidelines during the adolescent years, and find that the child has depressive symptoms, they have several options. There's guidelines for adolescent depression in the primary care setting that walks them through the training of that. They can give supportive counseling. They can refer them to services in the community. They can, and depending on severity, they can, if they opt to start them on medication, they can also provide them with referrals to psychologists and psychiatrists. But we know that that's very difficult. There are not a lot of pediatric trained providers out there. So these pediatricians can use SparkRx uh, as a bridge to that therapy, and they can initiate it right there. And that means that they can continue doing what they're doing. They can continue their referral. They can continue providing their own therapy, their own supportive guidance, and use that in the same vein. What's interesting is after we launched it commercially, about a quarter of the docs that have signed up with us, or I should say therapists, not docs, but therapists, have been LCSWs, licensed clinical social workers, psychologists, and other folks who see kids and are integrating the digital therapeutic SparkRx into their treatment. And by having it be a digital treatment that the therapist, can actually use themselves and see how it works, they can then work directly with their patient through each one of those levels and each one of those modules that uses behavioral activation to teach them how behavior affects mood and mood affects behavior, and how they can reverse that trend of sometimes when you're not when you're depressed, you engage in activities that are kind of an avoidance pattern, and how to turn that around and replace them with alternative coping behaviors to improve your mood.
So these mood disorders, major depressive disorder, obviously affects people of all ages. Why is it important to have a sort of bespoke product for teens rather than just building a digital therapeutic that addresses the condition for anybody?
Right. So, the first thing you learn in pediatric residency is that children are not little adults. They obviously go through different developmental stages, and through the adolescent years, it's a very specific, stage of that development. And a product that would work on a 30-year-old, or conversely on an 8-year-old, is not the same as what would work on a 13 or 17 or 18-year-old. And specifically, behavioral therapy of the cognitive behavioral therapy has been shown to be effective in treating depression and also anxiety and other psychiatric conditions and behavioral health conditions in that age group. So translating it into a digital solution that they can use anytime at any place in conjunction with therapy and support they're getting either in the community, through their pediatrician, through their family practitioner, through a counselor, that it just fits perfectly that way.
So let's take a step back and talk a little more about the landscape that you guys are working in. Do you see a lot of digital therapeutics like coming into the market in this kind of mental health space, or do you find that you're still sort of a pioneer in this space? And how has it changed since you've been working at SparkRx or on SparkRx?
So I've only been here a year, and I've learned a lot. As I joke around with people, a year ago, I didn't even know how to spell PDT, or prescription digital therapeutics. So I'm learning a lot, and it's all very interesting for me because as a clinician, we didn't have any tool that can definitively be given to a patient that I know that they're going to start using in my office, that I have used myself, and I can understand how it interacts and how it affects the patient. And that I can actually, one of these, the benefits of these therapeutics is that I can actually get report from the device as to how the patient is doing clinically and how they're engaging with the product. So as a clinician, I wished I had something like this. And although a lot of these things were being in the thought process, they didn't exist. After I worked clinically, I worked for a health plan. As a health plan medical director, I got pitched a lot of these uh, product as well. So I learned a lot more about them at that point and what they're capable of doing and not doing. And there are, as I said earlier, there are a lot of these coming to market. A lot of them are the behavioral health space because that's where there's a great deal of demand, and not just in treating direct, behavioral health conditions, but also being very specific to behavioral health conditions and how they affect chronic conditions. So, in other words, treating, diabetes, type 2 diabetes, or opioid addiction, or obesity, or things like that, or other irritable bowel syndrome. I'm just trying to think of some out loud. How to use these digital devices to treat these specific medical conditions, not just to treat behavioral health, but to also help them in the treatment of comorbid conditions. And what we're learning is that there are a lot of products out there, but the question is, what's going to get approved by, or what's going to get go through FDA regulatory process? Who's going to be the one in market that can commercialize? And also, right now, there's no product category for it, for digital therapeutics, so there's no pathway to reimbursement, and that's yet another challenge. That right now, you can't just put a product on the market, get a code for it, and then there's a specific fee schedule for it and get reimbursed. So those are, some of the challenges. It's the regulatory process. It's separating those products that have gone through that rigor versus those that have not, and then getting these to market in a way that they can get reimbursed for.
Yeah, that's interesting. I mean, are we seeing progress on that reimbursement front in terms of their systems level, more recognition, more kind of um, attitude towards let's create a pathway for this?
Yes and no. I don't like that. I never like when somebody gives me that answer, but the answer is yes and no. I mean, so providers want this. The patients want this. The society needs it. We need to have something that, we talk about in all the policies that are coming out now from the administration through legislation. You hear about the State of the Union address from President Biden. You hear about, from everybody. We need to develop solutions to behavioral health crisis. The solutions require an expansion of available resources, but the expansion through things like expanding the workforce or access to telehealth, those are all great solutions, and that's wonderful. But the truth is that to develop an expanding workforce of therapists takes years. Telehealth is wonderful. We were doing, as a pediatrician, we were doing telehealth decades ago. Barton Schmidt came out with guidelines. I think it was about 25 years ago, for doing telehealth for pediatrics. It's now finally getting reimbursed, right? Because it's being recognized as a solution, but it's still not scalable. You're still having the finite number of therapists giving treatment in different situations, in different venues. Digital therapeutics actually are able to be scaled infinitely, and they can be used as adjunct therapy. They can be used for therapy as a patient is waiting to see a therapist. They can be used as treatment in between appointments. But unfortunately, there are payers out there who have come out with statements saying that they will not reimburse it. They don't feel like it's been studied enough, and that's their decision. We are working with legislation to include digital therapeutics in mental health bills and even as standalone bills as product categories so they can be on the path to reimbursement. It's going to take time. It's very new. Providers, lawmakers, health plan, medical directors, there's a lot of education involved. And when you say, and there's nobody that I've ever spoken to has ever said this is a bad idea. Um, you know, it's a great idea and it works, and we know that. But it's getting paid for it. Fortunately, we're able to provide SparkRx at no cost to patient or providers currently under the enforcement policy, and we're very happy to do that because we believe, as a company, that we need to, this service is needed, and we're, it's our mission to provide that service. But of course, eventually, there needs to be a reimbursement stream.
So we talked a little bit about the relationship between digital therapeutics and talk therapy. What about between traditional pharma therapeutics? I know, obviously, huge business in the mood disorders. We as a world could prescribe a lot of psychiatric drugs there. I mean, is this potentially a substitute in some cases? Is it all additive like it is with therapy?
Yeah, so again, it could be an adjunct to this. We would never say that you should do this instead of pharmacotherapy. If your provider feels and the decision between you and your provider is that pharmacotherapy would benefit you, then that's the decision. But this can enhance that. This can help the cognitive behavioral therapy component with the pharmacotherapy. We know that pharmacotherapy works, cognitive behavioral therapy works. Together, they work more than the individual components. So the sum of those two work more than the parts. So together, they can be quite additive. And again, it's up to the provider, it's up to the patient. Some folks, I mean, this is what I've heard. It's not our necessarily what we tell people, but what we've heard is, hey, I want to use this before I start medication. Okay, if that's what you and your clinician feel that that's appropriate, then great. They feel that it is safer, and it's worth a try if avoid using medications, which they have side effects, and not everybody is comfortable using them, especially in the pediatric population.
Right. So we're getting to the end of our time. Just a couple of questions to wrap up for you. One is what's the roadmap for you guys? What's coming up for Limbix and SparkRx?
We continue to work with health plans on providing SparkRx as a solution to their members. We continue to work with large health systems to offer SparkRx to their patients. And our North Star, so to speak, is to submit for FDA clearance and to get it FDA cleared so we can put it on the market as a software, as a medical device. And then, of course, we're developing a pipeline of additional therapeutics. We're not. This isn't going to be a one and done. Our mission is to create, a platform of digital therapeutics for, mental health conditions, behavioral health conditions for young people that span, depression, anxiety. A lot of teens have sleeping disorders, eating disorders, etc. We started with depression because that was most prevalent. but we're continuing to develop out a pipeline of additional treatments.
Awesome. Well, I think that should do it for me. Thanks so much. Any other parting thoughts? Any final things you want to mention that you haven't had a chance to yet, or anything?
No, I really appreciate it. Anybody is more than welcome to hop on our website and ask us for additional information. We get a lot of requests from parents. We get requests from providers. We're more than happy to educate folks about this because, in 5 or 10 years, this is just going to be part of a treatment paradigm for a lot of different conditions, be it mental health, chronic disease. And I think it's important for people to learn about it, to educate themselves about it, and to understand it. So thank you for having me.
Yeah, thanks so much. Great chatting with you. That concludes this episode of the pharmaphorum podcast. You can find more information about this episode, including a download link and information about other installments in the series at pharmaphorum.com/podcast. The pharmaphorum podcast is also available on iTunes, Spotify, Acast, Stitcher, and Podme, where you can find and subscribe by searching for pharmaphorum. And don't forget to visit our website, where you can sign up for daily news and analysis bulletins, and to follow us on Twitter at pharmaphorum. Thanks for listening.